Nursing. Today we are going to talk about concepts of basic nutrition and cultural considerations. The following are theory learning objectives for this lesson. Restate the structure and function of the gastrointestinal system. Use the components of the U.S. Department of Agriculture, USDA MyPlate website to assist patients in planning their diets. List medical conditions that may occur because of protein, calorie, vitamin, or mineral deficiency or excess. Diagram the function of proteins, carbohydrates, fats, vitamins, minerals, and water in the human body. Infer food sources for proteins, carbohydrates, fats, vitamins, and minerals. Express a variety of factors that influence nutrition. Debate cultural influences on nutritional practices. Compare nutritional needs throughout life stages. Then we have our clinical practice learning objective as follows. Identify patients at risk for nutritional deficits. Practice a nutritional assessment on an assigned patient. Demonstrate therapeutic communication with a patient while discussing needed nutritional modification. Formulate a patient education plan for a prescribed therapeutic diet. Overview of the GI system and nutritional needs. The gastrointestinal tract is a continuous tube that allows food to be digested, nutrients to be absorbed, and waste to be eliminated. It begins with the mouth, where chewing and saliva begin breaking food down. The teeth and tongue work together to grind and move food for swallowing. From there, food passes into the pharynx and down the esophagus, which uses muscular contractions called peristalsis to push food into the stomach. In the stomach, food mixes with acid and enzymes to break down proteins. It then moves into the small intestine, where most digestion and absorption take place. The lining of the small intestine has villi and microvilli, which increase the surface area for absorption of nutrients. The large intestine follows, where water and electrolytes are absorbed and stool is formed. Finally, waste exits the body through the anus, completing the digestive process. Good dental hygiene and oral health are important because they are the starting point of digestion. If patients have missing teeth, gum disease, or difficulty swallowing, their nutritional intake may be reduced, which can affect their overall health. In addition to the main digestive tract, the body also relies on accessory organs to help process food. The salivary glands produce saliva, which contains enzymes that begin the breakdown of carbohydrates. The liver produces bile, which is essential for digesting fats and processing nutrients. The gallbladder stores and releases bile when fatty foods enter the small intestine. The pancreas produces digestive enzymes and bicarbonate, which neutralizes stomach acid as food enters the small intestine. These accessory organs are not part of the GI tract tube itself, but they play a vital role in digestion and nutrient absorption. Problems with any of these organs, such as pancreatitis, gallstones, or liver disease, can significantly affect a patient's ability to maintain adequate nutrition. Let's look at the mouth as the first organ of digestion. The mouth is the entry point of the digestive tract and plays several vital roles. Inside the mouth, we find the teeth, tongue, and salivary glands. The tongue, made mostly of skeletal muscle, is the most movable organ in the oral cavity and is essential for both speech and manipulating food during chewing. Adults normally have 32 permanent teeth, including incisors for cutting, cuspids for tearing, bicuspids for grinding, and molars for crushing food. Digestion actually begins in the mouth. As food enters, it is mechanically broken down by chewing and then chemically processed as it mixes with saliva. The parotid glands, the largest of the salivary glands, sit just in front of and slightly below each ear. These glands secrete saliva into the mouth, which contains enzymes such as amylase that begin the breakdown of starches. This step is crucial, as it starts converting complex carbohydrates into simpler sugars even before food reaches the stomach. For nursing assessment, remember to observe the condition of the lips, tongue, and oral mucosa. Always check under the tongue for lesions or signs of infection, and assess the patient's teeth and oral hygiene habits. Adequate saliva production depends on good hydration, so encourage fluid intake for patients at risk for dry mouth. When assisting patients with eating, consider their chewing ability, dental health, and any swallowing difficulties. These small details can significantly impact both nutrition and overall health. The pharynx, also known as the throat, is a muscular passageway that connects the nasal and oral cavities to the esophagus. When we swallow, the tongue pushes the bolus of food into the pharynx. At the same time, the epiglottis closes over the trachea to keep food and liquids out of the airway, preventing aspiration. This process highlights how swallowing is not just voluntary, but also involves automatic reflexes for protection. The esophagus is a muscular tube about 20 centimeters long that extends from the pharynx to the stomach. Its job is to propel food downward through coordinated muscular contractions called peristalsis. The esophageal lining secretes mucus to lubricate food and make passage smoother. At the lower end of the esophagus, the lower esophageal sphincter prevents stomach acid from refluxing back into the esophagus. If this sphincter doesn't work properly, patients may develop gastroesophageal reflux disease, GERD. From a nursing perspective, it is essential to assess whether patients have difficulty swallowing, a condition known as dysphagia. If a patient has dentures, they should be removed during oral assessments so the gums and oral tissues can be checked for lesions, irritation, or infection. It is also important to ask patients if they have experienced any recent problems with swallowing, since this can indicate risk for aspiration or esophageal obstruction. Identifying these concerns early is key to maintaining safe nutrition and preventing complications. The stomach is located in the upper left quadrant of the abdomen and typically holds about 1.5 liters of food and fluid. It acts as a temporary holding chamber, giving the body time to process food in stages. The stomach has two important sphincters, the cardiac sphincter at the top, which prevents stomach acid from refluxing into the esophagus, and the pyloric sphincter at the bottom, which controls the emptying of stomach contents into the small intestine. Inside the stomach, food is mixed with gastric juices that contain hydrochloric acid and digestive enzymes. The stomach's acidic environment, with a pH of about 1.5 to 3.5, helps break down proteins and kill harmful bacteria. The churning action of the stomach muscles converts food into a semi-liquid mixture called chyme. Digestion of proteins begins here primarily with the enzyme pepsin. Another key function of the stomach is its role in vitamin B12 absorption. Although absorption does not occur in the stomach itself, the stomach secretes intrinsic factor, a protein essential for vitamin B12 absorption later in the small intestine. Without intrinsic factor, patients can develop pernicious anemia. From a nursing perspective, it is important to assess patients for signs of gastric dysfunction, such as heartburn, acid reflux, bloating, or pain. Asking patients about medications that affect the stomach, such as antacids, proton pump inhibitors, or NSAIDs, is also important because these can alter stomach acid levels and digestive function. The small intestine is the primary site of digestion and absorption. It is divided into three regions: the duodenum, jejunum, and ileum. In the duodenum, chyme from the stomach mixes with bile from the liver and gallbladder and enzymes from the pancreas. These secretions break down fats, carbohydrates, and proteins into smaller molecules. The jejunum and ileum are lined with villi and microvilli, which dramatically increase surface area for absorption. This is where most nutrients, including vitamins, minerals, proteins, fats, and carbohydrates, enter the bloodstream. Without proper function of the small intestine, malabsorption syndromes can occur, leading to malnutrition. The large intestine is responsible for absorbing water and electrolytes, which solidify the remaining waste into stool. It consists of several segments: ascending, transverse, descending, sigmoid colon, rectum, and anus. The cecum, at the beginning of the large intestine, connects to the ileum. The large intestine also harbors beneficial bacteria that help break down some undigested materials and produce vitamins like vitamin K. The final step of digestion here is elimination of waste through defecation. From a nursing standpoint, stool characteristics can reveal a great deal about a patient's GI health. For example, pale or clay-colored stools may indicate liver or gallbladder dysfunction, while greasy or foul-smelling stools may indicate pancreatic insufficiency. Reviewing the gallbladder's role is also important. While the gallbladder stores bile, patients can live without it, though they may need dietary adjustments, particularly limiting fatty meals, to avoid digestive discomfort. This is a key teaching point for post-cholecystectomy patients. The liver, gallbladder, and pancreas. Each of these plays an essential role in breaking down food and regulating the body's metabolism. The liver is the largest internal organ, and its primary digestive function is producing bile. Bile helps break down fats into smaller droplets, making them easier for enzymes to digest. Beyond digestion, the liver plays a vital role in metabolism by processing carbohydrates, proteins, and fats, storing vitamins and minerals, and detoxifying harmful substances. From a nursing standpoint, we assess for signs of impaired liver function, such as jaundice, abnormal lab values like elevated liver enzymes, or changes in mental status that may suggest hepatic encephalopathy. The gallbladder sits just under the liver and serves as a storage and concentration site for bile. After a fatty meal, the gallbladder contracts and releases bile into the duodenum. Dysfunction here often presents with right upper quadrant pain, nausea, or intolerance to fatty foods. As nurses, we should be aware of gallstones, inflammation, and how they may cause acute or chronic problems for patients. The pancreas has both exocrine and endocrine functions. Its exocrine portion produces digestive enzymes and bicarbonate that neutralize stomach acid in the small intestine. Its endocrine portion produces insulin and glucagon, which are essential for blood sugar regulation. Pancreatic dysfunction can present as malabsorption, weight loss, or signs of diabetes. In nursing care, we carefully monitor labs like amylase, lipase, and glucose levels, and we assess for abdominal pain or steatorrhea, which are fatty, foul-smelling stools that indicate poor fat digestion. As nurses, our focus is on assessment and early recognition. We watch stool patterns, skin color, vital signs, and lab work, all of which may provide early warning signs of dysfunction in these organs. Prompt recognition allows us to intervene and collaborate with providers to prevent complications such as malnutrition, electrolyte imbalances, or uncontrolled diabetes. As the body ages, the gastrointestinal system also undergoes changes that can affect digestion, nutrition, and safety. First, dental caries and tooth loss are common in older adults. When teeth are missing or painful, chewing becomes difficult, which limits food choices and can lead to malnutrition. Dentures can help, but they may not fully restore chewing efficiency. Good oral hygiene and routine dental care are vital for preserving function. Another change is a decreased sense of taste. This can reduce appetite because food may seem bland, leading to decreased interest in eating. When appetite is reduced, calorie and protein intake often fall, which increases the risk of unintended weight loss and frailty. The gag reflex may also weaken with aging. This increases the risk of aspiration, especially in patients with neurologic conditions or after a stroke. Aspiration can lead to pneumonia, which is a major health risk for elderly patients. In addition, there is often decreased muscle tone at the esophageal and stomach sphincters, which can allow acid reflux or GERD. Patients may complain of heartburn or regurgitation after meals. Nurses should educate patients on dietary and lifestyle modifications, such as smaller meals and avoiding lying down right after eating. Older adults may also experience decreased gastric secretions, which interfere with protein digestion and absorption of vitamins such as B12, calcium, and iron. This may contribute to anemia and bone weakness. Finally, decreased peristalsis slows the movement of food through the intestines, increasing the risk of constipation. Constipation can worsen if patients have limited mobility, low fiber intake, or use certain medications like opioids. Nursing interventions include encouraging hydration, fiber, and activity when possible. For each of these changes, nurses should identify risk factors early and provide education. For example, encouraging good oral care, offering foods that are appealing to the senses, promoting safe swallowing techniques, and supporting bowel health all help maintain nutritional status and quality of life in older adults. Metabolism refers to all the chemical processes that occur in the body to maintain life. At the digestive level, metabolism begins when large molecules such as proteins, fats, and carbohydrates are broken down into smaller molecules, like amino acids, fatty acids, and glucose that the body can absorb. These smaller molecules are then transported through the bloodstream to cells, where they are used for energy production, growth, and repair. Metabolism can be divided into two categories: catabolism, which is the breakdown of larger molecules to release energy, and anabolism, which is the building of complex molecules needed for cell growth and repair. Together, these processes balance energy supply and demand in the body. The nutrients absorbed through digestion provide the raw materials for cellular metabolism. For example, glucose is broken down through cellular respiration to produce ATP, which is the energy currency of the cell. Proteins and fats can also be metabolized to meet energy needs. Without effective metabolism, nutrients from food would not be useful to the body. In the United States, over the past century, the shift from an agricultural-based lifestyle to a technology-driven, sedentary one has significantly altered energy demands. Physical activity has declined, but food intake has remained high, contributing to rising obesity rates. This mismatch between intake and output emphasizes the need for nurses to understand energy balance and counsel patients on lifestyle choices. As LPNs, you will see how factors such as diet, exercise, and illness can either speed up or slow down a person's metabolism, directly impacting their health outcomes. The USDA MyPlate guidelines are designed to help individuals make healthier food choices that support long-term health and prevent chronic diseases. MyPlate emphasizes balancing different food groups to ensure that people get the nutrients they need without consuming excess calories, fats, or sugars. The recommendations encourage eating a variety of fruits, vegetables, and whole grains, which provide fiber, vitamins, and minerals. Low-fat or fat-free dairy products, such as milk and yogurt, are also recommended to support bone health while limiting saturated fat intake. For protein, MyPlate suggests including lean meats, poultry, fish, beans, eggs, and nuts. This variety ensures adequate intake of essential amino acids while avoiding excessive saturated fats. Equally important, the guidelines stress reducing foods high in saturated fat, trans fats, cholesterol, sodium, and added sugars. Diets high in these substances increase the risk for obesity, hypertension, heart disease, and diabetes. Nurses should recognize how cultural preferences, cost, and availability of foods may impact a patient's ability to follow these recommendations. From a nursing perspective, it is helpful to ask patients about their access to healthy foods. Barriers such as limited time, financial strain, or food deserts can prevent individuals from eating a balanced diet. Nurses should encourage patients to make small, realistic changes, like replacing sugary beverages with water or choosing baked instead of fried foods. These small adjustments can have a significant impact on long-term health. Function of nutrients. Proteins are one of the most essential nutrients because they provide the building blocks for every tissue in the body. A constant supply of protein is needed to repair and replace tissues that are continuously breaking down, such as muscle, skin, and blood cells. In hospitalized patients, protein needs are often increased, especially in those recovering from surgery, burns, infections, wounds, or chronic illnesses, because their bodies require more materials for healing. Protein has many vital roles. It helps regulate fluid balance, preventing edema by maintaining plasma protein levels such as albumin. Proteins also play a role in producing hormones and enzymes which regulate metabolism and in antibody production, which supports immune defense. In addition, proteins help transport important nutrients like lipids, vitamins, and minerals through the bloodstream. From an energy perspective, protein supplies approximately 4 calories per gram, the same as carbohydrates. However, unlike carbohydrates, protein is not the body's preferred energy source. It is primarily reserved for growth, repair, and maintenance. Proteins are made up of amino acids, often referred to as the building blocks of life. There are 20 total amino acids, of which 9 are essential, meaning they must come from the diet, and 11 are non-essential, which the body can synthesize. If even one essential amino acid is missing, the body's ability to build or repair protein structures is impaired. Clinically, nurses may see lab tests such as serum protein, albumin, or prealbumin used to evaluate a patient's nutritional status. Low levels may indicate malnutrition, chronic illness, or liver disease. It is important to connect protein intake with both healing and overall patient outcomes. Proteins come from both animal and plant sources, but not all proteins are created equal. Animal sources, such as red meat, eggs, milk, and dairy products, poultry, and fish, are considered complete or high-quality proteins. This means they contain all 9 essential amino acids in the amounts required by the human body. These foods are especially important in diets where rapid tissue healing is needed, such as after surgery or illness. Plant sources include grains, legumes, nuts, seeds, and most vegetables. These are usually considered incomplete proteins because they are missing 1 or more essential amino acids. However, when eaten in the right combinations, such as rice with beans or peanut butter with whole grain bread, they can provide all of the essential amino acids, making them complementary proteins. As nurses, it's important to recognize that cultural, religious, and personal preferences play a large role in protein intake. For example, vegetarian and vegan patients may need guidance on how to combine plant foods effectively to ensure they meet their protein needs. In addition, socioeconomic factors can make access to protein-rich foods difficult for some patients, so cost-effective options like beans, eggs, or peanut butter may be good alternatives. When considering dietary needs, the recommended protein intake for the average adult is about 10–15% of total daily calories. For someone on an 1-800 calorie diet, that equals around 180 to 270 calories, or 45 to 68 grams of protein per day. Nurses should be able to calculate and apply these values when educating patients about their nutrition plans. The daily protein requirement for a healthy adult is usually between 46 to 56 grams per day, depending on age, sex, and body size. This represents about 10-15% of total daily calories in a balanced diet. However, protein needs are not the same for everyone. They vary with factors like activity level, overall health, illness, and food availability. For example, athletes, patients with wounds, burn injuries, or those recovering from surgery may require more protein to support tissue repair and immune function. Pregnant and lactating women also need additional protein to support fetal growth and milk production. The general calculation for protein requirements is based on body weight. For the average healthy adult, the recommended intake is 0.8 grams of protein per kilogram of body weight per day. To calculate this, divide the patient's weight in pounds by 2.2 to convert it to kilograms, and then multiply by 0.8. For example, a person who weighs 150 pounds, 68 kilograms, would require about 54 grams of protein each day. This formula gives a baseline requirement. Patients under stress or with higher needs may require 1.2 to 2.0 grams of protein per kilogram. As nurses, it is important to recognize when a patient's protein needs may be elevated and to monitor intake accordingly. For hospitalized patients, inadequate protein can delay wound healing, increase infection risk, and prolong recovery. Recognizing protein requirements and making recommendations for dietitians or care teams can significantly improve patient outcomes. Protein deficiency leads to serious health conditions, particularly in infants and children, and is most common in developing regions where food insecurity is prevalent. Two key conditions associated with protein deficiency are marasmus and kwashiorkor. Marasmus is a severe form of malnutrition caused by a lack of both protein and overall calories. It most often develops in the first year of life. These children appear extremely thin, with muscle wasting, loss of subcutaneous fat, delayed growth, and overall weakness. The body begins breaking down muscle and fat to meet energy needs, leaving the child very frail. Kwashiorkor, by contrast, occurs when a child consumes enough calories but not enough protein. It often develops in children who are weaned from breast milk and given diets high in carbohydrates but low in protein. Children with kwashiorkor typically have swelling, edema, skin and hair pigment changes, impaired growth and development, a distended abdomen, and liver enlargement. Unlike marasmus, these children may not appear thin because of the edema masking muscle loss. From a nursing perspective, it's important to understand how these deficiencies present and to recognize at-risk populations, even within the United States. For example, food insecurity, chronic illness, or eating disorders can all cause protein malnutrition. Nurses play a role in identifying signs such as muscle wasting, edema, and poor wound healing. Globally, health organizations work to prevent these conditions through nutrition programs, fortified foods, and breastfeeding promotion. The difference between marasmus and kwashiorkor is important. Marasmus is a total calorie and protein deficiency, while kwashiorkor is specifically a protein deficiency despite adequate calorie intake. While we usually focus on protein deficiency, it is also possible to consume too much protein, which can cause health concerns. Excess protein is metabolized by the liver and excreted by the kidneys as waste products such as urea. When the intake of protein is consistently higher than the body's needs, this creates extra stress on both the kidneys and the liver. Patients with pre-existing kidney or liver disease are especially vulnerable, as their organs may not be able to handle the additional workload. Excess protein in the diet often comes from high consumption of animal-based sources such as red meat, processed meats, and full-fat dairy. These foods may also be high in saturated fats, which increase the risk for obesity, cardiovascular disease, and certain cancers such as colon, breast, prostate, and pancreatic cancer. It is important to note that the average American diet already supplies about 1.5 to 2 times the dietary reference intake, DRI, for protein. This means that most healthy adults are getting more protein than they truly need. Unlike carbohydrates, excess protein is not stored directly for energy. Instead, surplus amino acids are converted into fat, which contributes to weight gain if energy needs are exceeded. From a nursing perspective, it's important to ask patients about their dietary patterns, especially those on high-protein diets for weight loss or bodybuilding. Education should emphasize balance, adequate protein for health and healing, but not so much that it causes strain on organ systems or leads to long-term health risks. There are several types of vegetarian diets, each with different restrictions. A lacto-ovo-vegetarian diet includes plant foods, dairy products, and eggs. A lacto-vegetarian diet includes plant foods and dairy, but excludes eggs. A vegan diet excludes all animal-based foods, including dairy, eggs, and even honey. Because of these differences, each group may have different nutritional risks. Well-planned vegetarian diets can be very healthy. Research shows they are often associated with lower risks of heart disease, hypertension, diabetes, obesity, and certain cancers. They are typically lower in saturated fat and higher in fiber, which supports cardiovascular and digestive health. However, nutrient deficiencies are a concern, especially for vegans. Without animal products, vegans may lack adequate amounts of vitamin B12, vitamin B6, vitamin D, iron, zinc, and riboflavin. B12 in particular is only naturally found in animal products, so vegans need fortified foods or supplements. Protein adequacy is another concern, but it can be met by combining plant foods such as legumes, grains, nuts, and seeds. As nurses, it is important to ask vegetarian or vegan patients how they meet their protein and vitamin needs. For hospitalized patients, you may need to collaborate with a dietitian to ensure adequate nutrition within their dietary restrictions. Understanding vegetarian diets also helps provide patient-centered care and respect for cultural and personal choices. Carbohydrates are the body's main source of energy. They should make up about 45–65% of total daily calories in a balanced diet, though the slide currently says 60%. That number is a bit high and should be adjusted to the accepted dietary guidelines range. Carbohydrates provide 4 calories per gram, the same as protein, and are critical for regulating protein and fat metabolism, supporting immune function, and promoting tissue growth. There are 3 main types of carbohydrates: simple, complex, and fiber. Simple carbohydrates include table sugar, sucrose, fruit sugar, fructose, and milk sugar, lactose. These are absorbed quickly into the bloodstream and cause a rapid rise in blood glucose. For patients with diabetes or hypoglycemia, simple carbs can be used to quickly correct low blood sugar. But for others, frequent intake can contribute to insulin spikes and weight gain. Complex carbohydrates include breads, pasta, cereals, rice, legumes, and starchy vegetables. These are broken down more slowly, providing a steady release of glucose and more consistent serum blood sugar levels. Ideally, most carbohydrate intake should come from these sources. Recommendations suggest that 85–95% of daily carbohydrate intake should be complex carbohydrates. Fiber, though not listed on the third slide, is another important type. It helps regulate bowel function, lowers cholesterol, and improves satiety, which aids in weight management. As future nurses, it's important to teach patients that carbohydrates are not bad. Instead, the type and amount matter. Diet fads often demonize carbs, but the reality is that balanced carbohydrate intake supports glucose regulation, insulin function, and overall health. Encourage patients to choose more complex carbs and fiber-rich foods while limiting added sugars and highly processed foods. Fiber is the portion of carbohydrates that cannot be broken down by human digestive enzymes. Unlike sugars and starches, it passes through the intestine undigested. This unique quality allows fiber to play several important roles in health. It increases stool bulk, which stimulates peristalsis and aids elimination. By moving waste products more efficiently through the intestines, fiber helps prevent constipation. Some fibers can also bind fats and cholesterol, which may decrease absorption of dietary fat and lower cholesterol levels over time. The recommended daily intake is 21 to 38 grams per day, but most people fall short of this amount. It's important to remind patients that when fiber intake is increased, water intake should also be increased to reduce bloating, abdominal discomfort, and gas. The best sources of fiber come from plant-based foods. Fruits such as apples, bananas, oranges, grapefruit, cantaloupe, and strawberries are excellent choices. Vegetables like green beans, broccoli, cauliflower, celery, corn, potatoes with skin, and sweet potatoes also provide high fiber content. Whole grains and cereals like oatmeal, all-bran, and shredded wheat are staple contributors to daily fiber intake. Finally, legumes such as kidney beans, pinto beans, lima beans, and black-eyed peas are both high in fiber and protein. Encouraging patients to eat a wide variety of these foods helps ensure they meet fiber recommendations. A practical tip: Grocery stores often display fresh fruits and vegetables at the entrance to encourage healthy choices. Fats are an essential nutrient that play multiple critical roles in the body. They supply a concentrated source of energy, providing about 9 calories per gram, more than double the calories provided by carbohydrates or protein. This means fats are energy-dense and must be consumed in moderation, but they are still necessary for health. In addition to energy, fats provide essential fatty acids that the body cannot make on its own. These fatty acids are crucial for cell membrane integrity, hormone synthesis, and brain health. Fats also add flavor and texture to foods, making meals more satisfying. Fats are important in vitamin absorption. Vitamins A, D, E, and K are all fat-soluble, meaning they require fat for absorption. Fats also help transport phytonutrients like carotenoids, which contribute to health and disease prevention. Another key function is insulation and temperature regulation. Fats form a protective layer under the skin to help regulate body heat. They also cushion and protect organs, reducing the risk of injury. From a nervous system perspective, fats help facilitate the transmission of nerve impulses, as the myelin sheath around nerves is made primarily of fat. They also give a feeling of fullness, which helps regulate appetite. Structurally, fats are composed of fatty acids and glycerol. Fatty acids can be saturated or unsaturated. Unsaturated fats are typically liquid at room temperature and are referred to as oils, examples being corn, safflower, and canola oil. Unsaturated fats are considered healthier because they lower LDL cholesterol and support cardiovascular health. One particularly beneficial group of fats is omega-3 fatty acids, found in salmon, sardines, tuna, walnuts, soybeans, and canola oil. Omega-3s are the most unsaturated fatty acids, supporting heart health, reducing inflammation, and improving cognitive function. However, it's important to remind students that while fish is an excellent source of omega-3s, deep frying fish negates much of its health value. Also, environmental contaminants like mercury mean fish should generally be limited to no more than 2 servings per week. For dietary guidelines, fats should account for 25–30% of daily calories. For an 1-800-calorie diet, that equals about 450–540 calories from fat. Of that, saturated fats should make up less than 10% of total calories, or roughly 45–54 calories. Excessive intake of saturated and trans fats increases the risk of heart disease. Blood lipid studies can help monitor fat-related health risks. HDL cholesterol is the good cholesterol that protects arteries. LDL cholesterol is the bad cholesterol that contributes to plaque buildup, and triglycerides represent circulating fats in the blood. Vitamins are essential nutrients that the body cannot produce in adequate amounts and must therefore come from food or supplements. Unlike macronutrients such as carbohydrates, proteins, and fats, vitamins do not supply calories, but they are crucial for supporting cellular processes, metabolism, and overall health. They play roles in immunity, wound healing, energy production, and nervous system function. Vitamins are categorized as water-soluble or fat-soluble. Water-soluble vitamins, which include the B-complex group and vitamin C, dissolve in water and are easily absorbed into the bloodstream. Because they are not stored in large amounts, excess water-soluble vitamins are usually excreted in urine. This means they need to be consumed regularly, but it also means toxicity is less likely compared to fat-soluble vitamins. For example, vitamin C supports collagen formation and immune health, while B vitamins help convert food into energy and support nervous system function. Fat-soluble vitamins, on the other hand, include A, D, E, and K. These are absorbed in the small intestine in the presence of dietary fat and bile salts, then stored in the liver and fatty tissues for later use. Because they are stored, there is a higher risk of toxicity if taken in excessive amounts, particularly with supplements. Vitamin A is important for vision and skin health, vitamin D for bone strength and calcium absorption, vitamin E for antioxidant protection, and vitamin K for blood clotting. Clinically, LPNs must be aware of vitamin use in patients. Some patients may self-prescribe large doses of vitamins, known as megavitamins, in the hopes of treating illness, boosting immunity, or aiding weight loss. This can be harmful, especially with fat-soluble vitamins, as toxicity can lead to organ damage. For example, too much vitamin A can cause liver injury, and too much vitamin D can cause dangerously high calcium levels. LPNs should also be familiar with common patient questions, such as whether vitamin C prevents colds or if certain supplements support weight loss. While vitamins are beneficial when used appropriately, evidence does not always support these popular beliefs, and patient education is essential. Minerals are inorganic substances that come from the earth and are absorbed by plants and animals, eventually becoming part of the human diet. Unlike vitamins, which are organic compounds, minerals are elements that are essential for metabolism, nerve conduction, fluid balance, bone structure, and cellular function. They do not provide calories, but they are critical cofactors in many enzymatic processes that keep the body functioning. Minerals are divided into major minerals and trace minerals, based on the amounts required by the body. Major minerals include calcium, magnesium, sodium, potassium, phosphorus, sulfur, and chlorine. These are needed in larger quantities and play significant roles such as maintaining strong bones and teeth, calcium, phosphorus, regulating nerve and muscle function, sodium, potassium, magnesium, and maintaining acid-base and fluid balance. Trace minerals are required in much smaller amounts but are equally important. These include iron, copper, iodine, manganese, cobalt, zinc, molybdenum, selenium, fluoride, and chromium. For example, iron is essential for hemoglobin production and oxygen transport, iodine is critical for thyroid hormone synthesis, and zinc supports wound healing and immune function. Even though these are needed in tiny amounts, deficiencies or toxicities can lead to serious health problems. For LPN practice, it is important to recognize the signs of mineral imbalance. For instance, iron deficiency is the most common nutritional deficiency worldwide and can cause anemia, while excess sodium intake is strongly linked to hypertension. Similarly, inadequate calcium or vitamin D intake can lead to osteoporosis. Patient teaching should include encouraging a balanced diet rich in whole foods, such as dairy products, leafy greens, lean meats, legumes, nuts, and whole grains, rather than relying heavily on supplements unless prescribed. Water is the most essential nutrient for life. While the body can survive weeks without food, it can only survive a few days without water. The adult human body is composed of approximately 50% to 69% water, with higher percentages in infants and lower percentages in older adults. This body water is distributed across intracellular fluid, extracellular fluid, and plasma, all of which are vital for maintaining homeostasis. A person's water requirement is about 1 milliliter per calorie consumed. For example, someone consuming 2,000 calories per day would need around 2,000 ml or 2 liters of water. Water plays a role in nearly every bodily process, including digestion, absorption of nutrients, circulation, elimination of waste, secretion of hormones, and regulation of body temperature. Because of its widespread role, the body must maintain a large reservoir of water to ensure proper function. The general rule in clinical care is that intake must equal output plus an additional 500 ml to account for insensible fluid loss, such as perspiration and respiration. This is why I and O monitoring is a critical nursing responsibility, particularly for patients on fluid restrictions due to conditions like heart failure, kidney disease, or liver failure. In these patients, nurses must calculate, record, and monitor intake and output meticulously to prevent overload or dehydration. It is also important to consider populations at risk for dehydration. Older adults often have a decreased thirst mechanism, while children and teenagers may become dehydrated due to high activity levels or inadequate fluid intake. Encouraging hydration through patient teaching is a key part of nursing care. Nurses should also educate patients about healthy fluid choices, such as water and milk, and caution them about excessive consumption of caffeinated or sugary beverages, which may contribute to dehydration or other health issues. Nutrition influences. Nutrition is influenced by many different factors, and as nurses, we need to recognize how these can affect patients' food choices and overall health. First, age plays a major role. Infants and toddlers need higher fat intake for brain development, while school-aged children require steady energy from carbohydrates and proteins for growth. Adolescents need additional calories and iron, while older adults often need fewer calories but more nutrient-dense foods due to slower metabolism and changes in digestion. Illness is another critical factor. Chronic diseases like diabetes, kidney failure, and heart disease often require strict dietary modifications. For example, kidney patients may need to limit protein, potassium, or sodium. Illness can also decrease appetite, which complicates recovery. Emotional status has a large impact as well. Stress, depression, and anxiety can all change eating patterns, leading to overeating, undereating, or reliance on unhealthy comfort foods. Similarly, economic status affects the quality and availability of food. Patients with limited income may turn to inexpensive, high-calorie, nutrient-poor foods rather than fresh produce or lean proteins. Religious practices influence food choices, too. For example, Islam prohibits pork and alcohol, Judaism requires kosher food preparation, and Seventh-day Adventists often follow vegetarian diets. Culture also shapes dietary habits. For instance, traditional African American diets may be high in fried foods, while Hispanic diets may include beans, rice, and tortillas as staples, and many Asian diets rely heavily on rice and vegetables. These patterns have both health benefits and risks depending on preparation and balance. As future nurses, you must be aware of these influences so that you can provide individualized, respectful, and realistic nutrition guidance for each patient. Nutrition care should never be one size fits all. Instead, it must adapt to the patient's age, health, emotions, resources, religion, and cultural background. When we talk about nutrition, we have to consider culture as a very strong influence. People's food preferences are often shaped by the traditions of their family and community, and this can impact both the benefits and risks associated with their diet. For example, traditional African American diets often include greens, beans, cornbread, sweet potatoes, pork, catfish, and chicken. While these foods can be nourishing, preparation styles may contribute to higher levels of fat, sugar, and salt. As nurses, it is important to recognize both the strengths and the challenges in these dietary patterns so that we can provide education without dismissing cultural traditions. Hispanic American diets are typically rich in carbohydrates such as beans, rice, corn, and tortillas. These foods provide energy, but the frequent use of lard in cooking can increase fat intake. Nurses can encourage healthier cooking methods without disregarding traditional meals, which are often central to family life and identity. Asian American diets are often high in rice, noodles, and vegetables, with relatively smaller portions of meat and fish. While these patterns can promote health, some dishes may still be high in sodium and fat, especially if monosodium glutamate, MSG, or fried cooking methods are used. It is important to balance cultural respect with guidance for managing chronic conditions like hypertension. Middle Eastern American diets often include yogurt, lamb, chicken, rice, and a variety of fruits and vegetables. Fermented dairy products are common and healthy, but preparation can vary based on religion. For Muslim patients, halal dietary restrictions may apply, which means certain foods must be avoided or specially prepared. As LPNs, honoring religious and cultural food preferences is a key part of patient-centered care, especially when families may want to bring in home-cooked meals. When providing nutrition counseling, it is very important to consider the patient's cultural food patterns. Instead of trying to change everything about their diet, the goal should be to modify preparation methods so that the meals are healthier while still honoring the foods that are meaningful to them. For example, we can encourage patients to bake or grill foods instead of frying, or to season with herbs and spices instead of relying on excess salt. This approach maintains cultural traditions while reducing health risks such as hypertension, obesity, and cardiovascular disease. As nurses, we must also educate patients about ways to reduce fat and sodium in their meals, teaching them simple substitutions, such as using lean cuts of meat, switching from lard to healthier oils, or adding more vegetables to traditional recipes can make a big difference in long-term health outcomes. Respectful counseling should emphasize collaboration rather than restriction, so patients feel supported in making sustainable changes that fit their lifestyle and culture. When we look at the nutritional needs of infants, we must remember that the first year of life is one of the most rapid growth periods. Infants are expected to double their birth weight by 6 months of age and triple it by their first birthday. For example, a baby born at 7 pounds 14 ounces should weigh around 15 to 16 pounds at 6 months and about 23 to 24 pounds at 1 year. Nurses should teach parents that this is a general guideline and that growth charts are the best tool to track progress. Breast milk is the gold standard for infant nutrition. The American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months and continued breastfeeding for the first year and beyond, as long as mutually desired by mother and infant. Breast milk provides antibodies, enzymes, and nutrients that formula cannot fully replicate. For families who use formula, it is important to note that infant formulas are modified forms of cow's milk. They are made more digestible and nutritionally complete by adding carbohydrates, fats, and vitamins to support infant growth. Nurses should counsel parents never to feed infants plain cow's milk before 1 year, as it can lead to intestinal bleeding, iron deficiency, and kidney strain. Solid foods are typically introduced between 4 and 6 months when infants show developmental readiness. Signs include good head and neck control, the ability to sit with support, and showing interest in foods. Start with iron-fortified cereals, then gradually introduce pureed vegetables, fruits, and protein-rich foods. Pediatricians recommend avoiding juice in the first year due to its high sugar content. Instead, small amounts of water may be offered after 6 months with healthcare provider approval. As LPNs, it is vital to support families in recognizing infant feeding cues, maintaining safe feeding practices, and promoting healthy growth and development. When discussing the nutritional needs of toddlers and preschoolers, it is important to highlight that this age group, between 2 and 5 years, is in a stage of rapid growth and development but with smaller appetites than infants. They require less milk than before, as their diet shifts toward more solid foods. At this stage, portion sizes should be small to match their stomach capacity and to prevent waste, but meals should be nutrient-dense. Toddlers benefit from foods that are soft, easy to chew, and served as single items rather than mixed dishes, since many young children prefer foods that are not touching or combined. Their food preferences can change daily, making it frustrating for caregivers. A child may love a food one day and completely refuse it the next. Caregivers should respond with patience and continue to offer a variety of healthy options without forcing a child to eat. Positive mealtime environments make a significant difference. Using colorful foods like peas and carrots and serving meals in smaller, child-friendly plates and utensils can help encourage intake. Children may also be more willing to eat when their dishes feature favorite colors or characters. It's essential to emphasize that pressuring or forcing a child to eat can lead to negative associations with food and even long-term feeding issues. Instead, offer balanced meals consistently and allow the child to choose what and how much to eat from the plate. The goal during these years is to set the foundation for healthy eating habits, encourage independence, and prevent mealtime battles. When we talk about school-age children, we're looking at ages 6 to 12. At this stage, children are more independent with their food choices, but they are also influenced by their peers and advertising. Many children in this age group develop strong preferences for sweet, salty, and high-fat foods such as soda, candy, cake, and fast food. These foods provide calories but very little nutritional value, and excessive intake can lead to problems such as obesity, hypertension, and poor concentration in school. A healthy breakfast is one of the most important interventions for school-aged children. Research shows that children who eat a well-balanced breakfast have better attention spans, improved academic performance, and fewer behavior issues. Options like milk and cereal, whole grain toast, fruit, and eggs provide a balance of protein and complex carbohydrates to sustain energy throughout the morning. Nutritious after-school snacks are also important because this is often the time of day when children are hungriest. Healthy options like yogurt with fruit, peanut butter on whole grain crackers, or fresh vegetables with hummus can help meet nutritional needs without adding excessive sugar or sodium. It's also important to recognize the environmental factors at play. School-aged children are very susceptible to marketing, especially commercials that pair fast food with prizes or fun experiences. Peer pressure may also sway them toward less healthy choices. This is why school lunch programs are so critical. According to USDA guidelines, lunches should be nutritious, reasonably priced, reduced in fat and sodium, and reflect a balance across the MyPlate categories. As LPNs, you may find yourself educating parents or supporting school wellness initiatives. Reinforcing the importance of balanced meals and healthy snacks at this age can lay the foundation for lifelong health. Now we are moving into the adolescent stage, which is one of the most nutritionally demanding times of life. During adolescence, teenagers often consume large amounts of fast food, whether from restaurants, cafeterias, or vending machines. This is partly due to busy schedules, peer influence, and the desire for convenience. The challenge is that these foods are often very high in calories, fat, sugar, and sodium, but provide very little nutritional value. During a growth spurt, the body's energy needs rise significantly, and without proper nutrients, teens may meet calorie needs but miss important vitamins and minerals. Adolescent females are especially at risk for iron deficiency once menstruation begins. Iron-rich foods such as lean meats, beans, and fortified cereals are important to prevent anemia, which can cause fatigue and impact learning. Another important point is that many adolescents skip breakfast, often because they are rushed in the morning or simply don't feel hungry. Skipping breakfast has been shown to negatively affect concentration, school performance, and energy levels throughout the day. As nurses, we need to educate both adolescents and their families on the importance of balanced meals, especially for student athletes, who require additional calories and protein to support muscle development and activity. By understanding the unique needs of this age group, we can better support healthy eating patterns that can carry into adulthood. Now let's look at nutrition during adulthood. Many adults rely heavily on fast foods and convenience meals because of busy schedules and family responsibilities. When both parents are working, preparing fresh meals after a long day often feels like a burden. This reliance on processed and convenience foods contributes to obesity and hypertension, which remain two of the most common health issues among adults. These foods are usually high in fat, sodium, and sugar, which all increase the risk for cardiovascular disease, type 2 diabetes, and metabolic syndrome. A lack of exercise compounds the problem, as many adults report they feel they have little or no time for physical activity. Employers are noticing the health costs of these lifestyle patterns, leading to rising health insurance premiums and reduced health benefits. Imagine how impactful it would be if workplaces encouraged healthier habits by offering incentives for exercise, weight reduction, or smoking cessation. As nurses, we need to recognize the barriers adults face, but also help patients understand that small, manageable changes, like preparing meals at home once or twice a week, reducing sugary beverages, or adding short bouts of daily walking, can greatly improve long-term health outcomes. Now let's look at the nutritional needs of older adults. Older adults are among the most at risk for inadequate nutrition due to changes in appetite, physical ability, and social circumstances. As activity levels decline with age, calorie requirements may need to decrease to prevent unnecessary weight gain. However, even with reduced calorie needs, older adults still require nutrient-dense foods rich in vitamins, minerals, and protein to maintain strength, immunity, and healing. Physical limitations such as arthritis or poor mobility can make food shopping and preparation more challenging, which increases the risk of relying on processed or convenience foods. Eating alone is also a major factor. Social isolation often reduces appetite and meal enjoyment, so arranging for companionship during meals can improve both intake and quality of life. In addition, limited income can restrict food choices, sometimes forcing older adults to choose less expensive but less nutritious foods. As nurses, we should encourage daily exercise, including weight-bearing activities, to help preserve muscle mass and flexibility. We should also identify barriers such as cost, weather, or lifelong inactivity, and work with patients and families to find practical solutions. Supporting older adults in making small, manageable dietary and activity adjustments can greatly improve their overall health and independence. We have reached the reference page. Thank you for watching the presentation.